Question 1. A 2-year-old refuses to eat vegetables but insists on eating the same cereal every morning. What is the best nursing response? A. Encourage the child to try new foods each meal. B. Punish the child for refusing vegetables. C. Continue offering the cereal and introduce new foods gradually. D. Remove the cereal to promote variety. Answer: C. Rationale: toddlers commonly exhibit food jags, preferring repetitive foods. Gradually introducing new foods maintains nutrition and autonomy. Strategy: for toddlers, choose answers that respect autonomy and gradual adaptation. Question 2. A nurse is assessing a 6-month-old. Which developmental milestone should the infant have achieved? A. Walking independently. B. Sitting without support. C. Rolling from back to abdomen. D. Saying 2-word phrases. Answer: C. Rationale: by 6 months, infants roll from back to abdomen. Sitting without support occurs around 8 months. Strategy: know the sequential pattern of gross motor skills before age 1. Question 3. The parent of a 4-year-old says, "My child blames the chair when he trips." What is the nurse's best explanation? A. He is showing magical thinking, which is normal for his age. B. He is unable to distinguish fantasy from reality. C. He is showing delayed cognitive development. D. He needs a psychological assessment. Answer: A. Rationale: preschoolers, 3 to 6 years, demonstrate magical thinking, believing objects have life or intent. Strategy: identify normal age-appropriate egocentric thought processes. Question 4. A 10-month-old infant is being evaluated for developmental delay. Which finding should the nurse report? A. Crawls on hands and knees. B. Pulls to stand. C. Says mama and dada. D. Doesn't respond to name. Answer: D. Rationale: by 10 months, infants should respond to their name and simple commands. Failure indicates possible hearing or cognitive delay. Strategy: always link milestones with sensory and communication responses. Question 5. During a home visit, the nurse observes a 3-year-old playing beside another child but not interacting. What type of play is this? A. Parallel play. B. Cooperative play. C. Associative play. D. Solitary play. Answer: A. Rationale: parallel play is typical for toddlers. They play beside others but don't directly interact. Strategy: match play type to developmental stage. Question 6. Which toy is most appropriate for a 9-month-old? A. Large building blocks. B. Picture books with simple images. C. Crayons and paper. D. Board games. Answer: B. Rationale: infants enjoy visual stimulation and objects they can grasp safely. Strategy: safety and sensory engagement guide toy selection for infants. Question 7. A parent expresses concern that her 15-month-old is not yet talking. What is the nurse's best response? A. Your child should already speak in short sentences. B. Some children use gestures before words, let's assess comprehension. C. That's very abnormal at this age. D. Speech therapy should start immediately. Answer: B. Rationale: at 15 months, understanding exceeds speech, gestures and comprehension are key indicators. Strategy: assess receptive language before expressive delays. Question 8. The nurse notes a 5-year-old insists on dressing independently even if it takes a long time. Which developmental stage does this show? A. Trust versus mistrust. B. Autonomy versus shame and doubt. C. Initiative versus guilt. D. Industry versus inferiority. Answer: C. Rationale: preschoolers, 3 to 6 years, develop initiative by asserting control over tasks. Strategy: match Erickson's psychosocial stage with age-related behavior. Question 9. A 7-year-old hospitalized for appendectomy asks, when can I go back to school? What does this question show? A. Fear of pain. B. Desire for control. C. Concern about peer acceptance. D. Regression to earlier behavior. Answer: C. Rationale: school-age children value peer relationships and fear social exclusion. Strategy: recognize peer relationships as dominant motivators for ages 6 to 12. Question 10. Which statement by a parent of a 3-year-old requires intervention? A. We let him pick out his clothes each morning. B. He sleeps in his own bed now. C. We expect him to sit quietly during a 2-hour church service. D. He helps set the table. Answer: C. Rationale: preschoolers have short attention spans, unrealistic expectations lead to frustration. Strategy, pick options reflecting age-appropriate attention and patience limits. Question 11. The nurse observes a 12-month-old transferring a toy from one hand to another. What does this indicate? A. Normal fine motor development. B. Delayed gross motor skills. C. Cognitive regression. D. Poor coordination. Answer, A. Rationale, by 7 to 12 months, infants develop fine motor skills such as transferring objects hand to hand. Strategy, focus on fine versus gross motor indicators for milestone evaluation. Question 12. A 4-year-old hospitalized for tonsillectomy refuses to eat because the food will hurt. What should the nurse do first? A. Force feed small bites. B. Offer cold, soothing foods like ice pops. C. Encourage solid foods for faster healing. D. Restrict all oral intake until pain stops. Answer, B. Rationale, preschoolers associate discomfort with eating, cold foods reduce throat pain and promote hydration. Strategy, combine physical comfort with psychological reassurance for preschoolers. Question 13. During assessment, a 6-year-old proudly shows the nurse's school uniform. This behavior reflects A. Initiative. B. Industry. C. Autonomy. D. Identity. Answer, B. Rationale, school-age children, 6 to 12 years, gain a sense of industry and pride in accomplishments. Strategy, recognize Erickson's industry versus inferiority as driven by productivity and approval. Question 14. A mother is concerned that her 9-year-old daughter prefers playing with boys. What is the nurse's best response? A. This could suggest gender confusion. B. Mixed gender friendships are normal at this age. C. She should be redirected toward girls. D. You should limit playtime with boys. Answer, B. Rationale, school-age children explore friendships regardless of gender, it's part of social flexibility. Strategy, avoid pathologizing normal social experimentation. Question 15. The nurse teaches a parent about bedtime routines for a 3-year-old. Which instruction is most appropriate? A. Allow screen time to help the child fall asleep. B. Use consistent bedtime rituals each night. C. Let the child decide when to sleep. D. Keep lights bright to prevent fear. Answer, B. Rationale, consistent routines reduce anxiety and promote security in preschoolers. Strategy, predictability promotes trust and reduces nighttime resistance. Question 16. Which activity best promotes development in a 2-year-old? A. Playing board games. B. Pushing and pulling a toy wagon. C. Reading chapter books aloud. D. Practicing handwriting. Answer, B. Rationale, gross motor skills such as pushing and pulling are vital at this stage. Strategy, select activities that enhance motor coordination and autonomy. Question 17. A 5-year-old tells the nurse, I was sick because I was bad. What should the nurse conclude? A. The child misunderstands cause and effect. B. The child has early signs of depression. C. The child is seeking punishment. D. The child shows advanced emotional reasoning. Answer, A. Rationale, preschoolers engage in egocentric thinking, linking illness to guilt or misbehavior. Strategy, recognize moral realism and magical thinking in preschool cognition. Question 18. The nurse observes a 14-year-old refusing to wear the same clothes as her parents. This behavior indicates A. Rebellion needing counseling. B. Normal identity formation. C. Low self-esteem. D. Social withdrawal. Answer, B. Rationale, adolescents develop individuality and self-expression as part of identity formation. Strategy, distinguish between normal autonomy and defiant pathology. Question 19. A 6-month-old gains 6 ounces in 2 months. How should the nurse interpret this finding? A. Normal growth pattern. B. Inadequate weight gain requiring evaluation. C. Excessive feeding. D. Late teething issue. Answer, B. Rationale, after 6 months, infants should gain 4 to 7 ounces per week, slower gain may indicate nutritional concern. Strategy, know normal growth rates to identify subtle nutritional deficits. Question 20. A 7-year-old explains how plants grow and uses logic to describe it. What developmental milestone does this show? A. Concrete operational thinking. B. Pre-operational thought. C. Abstract reasoning. D. Symbolic play. Answer, A. Rationale, concrete operations, 7 to 11 years, allow logical thought about tangible objects. Strategy, identify logical thinking as hallmark of middle childhood cognition. Question 21. A parent reports that her 18-month-old constantly says no. The nurse's best response is: A. This shows defiance and needs discipline. B. This is normal autonomy development. C. Your child may have oppositional tendencies. D. Try to avoid giving your child choices. Answer, B. Rationale, saying no expresses independence during autonomy development, 1 to 3 years. Strategy, normalize behaviors expressing autonomy and control. Question 22. Which activity best fosters fine motor skill in a 4-year-old? A. Cutting shapes with safety scissors. B. Kicking a soccer ball. C. Riding a tricycle. D. Climbing stairs. Answer, A. Rationale, cutting improves hand-eye coordination and fine motor development. Strategy, match fine motor to activities requiring small muscle precision. Question 23. A 9-year-old hospitalized for asthma asks detailed questions about the nebulizer. What is the best nursing approach? A. Distract with toys. B. Provide clear, factual explanations. C. Limit information to avoid anxiety. D. Ignore the question. Answer, B. Rationale, school-age children seek understanding and mastery, clear facts reduce fear. Strategy, support the child's need for concrete explanations. Question 24. The nurse observes a 2-year-old using a spoon but spilling food. What should the nurse do? A. Feed the child to avoid mess. B. Praise attempts at self-feeding. C. Replace spoon with bottle. D. Punish for messiness. Answer, B. Rationale, self-feeding builds independence and coordination. Strategy, reinforce autonomy and practice over. Question 25. A 15-year-old becomes self-conscious about acne. What nursing statement supports positive body image? A. You'll outgrow this phase soon. B. Let's discuss how you feel about your skin changes. C. Avoid looking in mirrors until it clears. D. Ignore your appearance and focus on studies. Answer, B. Rationale, open discussion encourages healthy coping with body changes. Strategy, encourage communication, not avoidance, during identity formation. Question 26. Which activity is developmentally appropriate for a 10-year-old? A. Playing team sports. B. Scribbling with crayons. C. Learning to walk. D. Teething. Answer, A. Rationale, team activities meet the school-age child's social and physical needs. Strategy, choose social collaboration and skill mastery activities. Question 27. A 3-month-old turns toward a nurse's voice. What does this finding indicate? A. Delayed hearing. B. Normal auditory development. C. Impaired response. D. Abnormal reflex. Answer, B. Rationale, infants recognize voices by 3 months, absence may indicate hearing deficit. Strategy, assess early sensory responses as developmental indicators. Question 28. A 5-year-old hospitalized for surgery asks if the nurse will cut her open forever. The best reply is: A. Don't worry, it won't hurt. B. No, the doctor will fix your tummy, and it will heal soon. C. That's not something to think about. D. You'll understand when you're older. Answer, B. Rationale, honest, concrete explanations alleviate preschooler fears of bodily harm. Strategy, use literal language with reassurance of body integrity. Question 29. The parent of a 16-year-old reports arguments about curfew. The nurse should explain. A. Conflict is abnormal and needs family therapy. B. Mild conflict reflects adolescent independence. C. The parent should enforce punishment strictly. D. The teen is showing oppositional disorder. Answer, B. Rationale, adolescents test limits as part of developing autonomy. Strategy, recognize autonomy conflicts as part of identity development. Question 30. A 6-year-old says, my doll is sad because I left her home. This represents: A. Animism. B. Egocentrism. C. Conservation. D. Object permanence. Answer, A. Rationale, animism attributes human feelings to inanimate objects, typical in preoperational stage. Strategy, link Piaget's preoperational traits, 2 to 7 years, to imaginative thought. Question 31. Which milestone should a 12-month-old have achieved? A. Walking independently. B. Speaking 10 words. C. Understanding color differences. D. Stacking 6 blocks. Answer, A. Rationale, many infants walk by 12 to 15 months, speech and fine motor come later. Strategy, recall gross motor milestones before fine or verbal ones. Question 32. The nurse notes that a 4-year-old fears taking medicine because it will make my tummy disappear. What concept explains this? A. Magical thinking. B. Reversibility. C. Logical reasoning. D. Abstract thought. Answer, A. Rationale, preschoolers believe words or actions can cause physical changes. Strategy, use simple reassurance and concrete demonstrations. Question 33. Which behavior is typical of a 2-year-old during hospitalization? A. Fear of strangers. B. Desire to play with peers. C. Regression to earlier habits. D. Understanding time. Answer, C. Rationale, toddlers often regress under stress, e.g., bedwetting or clinginess. Strategy, expect regression, avoid punishment. Question 34. A nurse evaluates a 13-year-old's social development. Which finding is expected? A. Prefers family activities. B. Seeks approval from peers. C. Plays mostly alone. D. Avoids group involvement. Answer, B. Rationale, adolescents prioritize peer relationships for self-identity. Strategy, link self-esteem to peer acceptance during teenage years. Question 35. A 6-year-old learning to tell time is demonstrating. A. Conservation. B. Seriation. C. Abstract thinking. D. Egocentrism. Answer, B. Rationale, seriation, ordering by time, size, or sequence, is a concrete operational skill. Strategy, identify Piaget's terms through practical examples. Question 36. Which toy best suits an 18-month-old? A. Large stacking blocks. B. Puzzles with many small pieces. C. Card games. D. Model cars with detachable parts. Answer, A. Rationale, toddlers need large, safe objects to improve motor coordination. Strategy, prioritize safety and simplicity for toddlers. Question 37. A 7-year-old hospitalized for a week begins to withdraw and miss school. The best nursing action is to A. Allow extended sleep. B. Arrange schoolwork and contact with classmates. C. Focus only on physical recovery. D. Avoid discussing school. Answer, B. Rationale, maintaining normal routines and peer contact supports emotional adjustment. Strategy, preserve connections to normal life for hospitalized children. Question 38. A 3-year-old says, I am a superhero. The nurse interprets this as A. Imaginative play, normal for age. B. A delusional thought. C. Cognitive regression. D. Language disorder. Answer, A. Rationale, imaginative play is normal and supports creativity in preschoolers. Strategy, support fantasy as a healthy developmental tool. Question 39. The nurse teaches parents of a 2-month-old about tummy time. The main purpose is to A. Improve digestion. B. Strengthen neck and shoulder muscles. C. Encourage sleep. D. Reduce appetite. Answer, B. Rationale, tummy time promotes motor control and prevents positional head flattening. Strategy, associate position changes with developmental benefit. Question 40. A 16-year-old reports feeling different from everyone. What should the nurse understand? A. Typical adolescent egocentrism. B. Low intelligence. C. Psychotic thinking. D. Personality disorder. Answer, A. Rationale, adolescents often experience the imaginary audience and personal fable concepts. Strategy, normalize self-consciousness in adolescence. Question 41. A 5-year-old asks, where do babies come from? The best nursing reply is A. Ask your parents later. B. Babies grow inside their mother's tummy. C. That's too complicated for you. D. You shouldn't talk about that. Answer, B. Rationale, preschoolers need simple, truthful, and concrete answers. Strategy, use age-appropriate honesty to build trust. Question 42. The nurse notes a 1-year-old cries when a parent leaves the room. This behavior reflects A. Separation anxiety, normal for age. B. Pathological attachment. C. Social phobia. D. Cognitive delay. Answer, A. Rationale, Separation anxiety peaks at 9 to 18 months. Strategy, recognize distress as a sign of healthy attachment. Question 43. Which toy is ideal for a hospitalized 7-year-old? A. Coloring books. B. Rattles. C. Stacking rings. D. Mobiles. Answer, A. Rationale, school-age children enjoy structured, creative, and independent activities. Strategy, provide activities requiring skill and attention. Question 44. A 9-year-old insists on following all classroom rules exactly. This behavior shows A. Moral realism. B. Abstract ethics. C. Premoral behavior. D. Egocentric thought. Answer, A. Rationale, school-age children view rules as absolute and unchangeable. Strategy, distinguish moral realism, rule obedience, from moral relativism, adolescence. Question 45. A 3-year-old insists that a tall, thin glass has more juice than a short, wide one. This demonstrates A. Lack of conservation. B. Abstract reasoning. C. Logical thought. D. Object permanence. Answer, A. Rationale, preschoolers fail conservation tasks due to focus on one dimension. Strategy, identify Piaget's conservation as key transition to concrete thought. Question 46. A nurse observes a 5-year-old brushing a doll's hair and pretending to feed it. This play is A. Symbolic play. B. Solitary play. C. Competitive play. D. Parallel play. Answer, A. Rationale, symbolic or pretend play fosters imagination and social understanding. Strategy, match symbolic play with preschool years. Question 47. The nurse observes a 10-year-old mentoring a younger sibling in homework. This behavior demonstrates A. Initiative. B. Industry. C. Autonomy. D. Identity. Answer, B. Rationale, helping others reinforces productivity and competence. Strategy, identify industrious behavior as pride and contribution. Question 48. A 2-year-old cries during diaper changes and refuses new caregivers. This indicates A. Normal stranger anxiety. B. Sensory processing disorder. C. Attachment problem. D. Regression. Answer, A. Rationale, stranger anxiety and clinginess are normal in toddlers. Strategy, normalize stranger anxiety as a developmental safety signal. Question 49. A 15-year-old frequently checks their appearance before school. The nurse should A. Discourage this behavior. B. Recognize it as typical self-consciousness. C. Suggest mental health evaluation. D. Restrict mirror use. Answer, B. Rationale, adolescents are preoccupied with body image and peer perception. Strategy, reinforce confidence without criticism. Question 50. A 7-month-old drops a toy and looks for it on the floor. What concept does this reflect? A. Object permanence. B. Egocentrism. C. Symbolic thinking. D. Seriation. Answer, A. Rationale, by 6 to 8 months, infants understand objects exist even when unseen. Strategy, link object permanence with sensorimotor cognitive growth. You just mastered the must-know pediatric growth and development questions for the NCLEX. If you found this helpful, hit like, subscribe, and share to help other nursing students crush their exams too. See you in the next video, where we make NCLEX simple, one question at a time.